Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Dr. Khalid Alharbi. I will be talking about mechanical ventilation, the basics for non-intensivist, and mainly our focus will be mechanical ventilation for COVID-19 patient, only the basics. So when we're talking about invasive mechanical ventilation, an important thing to consider is the equation of motion. So in a spontaneously breathing patient, the pressure that is generated to take a breath is a negative pressure, and it needs to overcome the pressure due to resistance plus the pressure due to the elastance work of the lungs. And in invasive mechanical ventilation, the same can be applied, and this is through the iron lung, which is the first mode of invasive mechanical ventilation on old method, as shown in the picture here. And this was widely popular during the polio pandemic. When we talk about an invasive mechanical ventilation, which is a positive pressure ventilation, it is the same. It's a positive pressure ventilation that is required to overcome the pressure due to the resistance times the volume plus the resistance and flow. So in other words, it needs to overcome the resistance from the airways and the elastics work from the lungs. The basic modes of mechanical ventilations that we will speak about specifically for the COVID-19, you can have a volume assist control mode or a pressure assist control mode, and I will be talking briefly about both of them. So in a volume assist control, so in any mechanical ventilation, we have variables, which are the trigger, control, and cycle. So in a volume assist control, the trigger is a time or patient time in a set frequency, or the patient triggering the ventilator to initiate an assist breath. Or the control will be the flow in this mode, and the cycle or the end of the breathing will be determined by the preset volume. So if you have here the graph showing this is the first breath is the control breath, the second breath is an assisted breath, and you can tell that this is an assisted breath because of the dip here indicating that this is an assisted breath. And a pressure assisted control, the trigger will be the time or patient, again the control will be the pressure, and the cycle will be the time. And again in the graph you can see the first breath, which is completely controlled, and in the second breath is an assisted control because of this dip. And this is the baseline, which is the positive end expiratory pressure, beep. So in mechanical ventilation specifically, so what controls the carbon dioxide removal, the ventilation? It's controlled by the minute ventilation, which is the tidal volume times the respiratory rate. And this is an important thing to consider, and I will be giving examples later on. The oxygenation in the mechanical ventilation is controlled by the positive end expiratory pressure and by the FiO2 that you can set on the mechanical ventilation. And how to set the PEEP and to the FiO2. So in these COVID-19 patients, we are talking generally about ARDS. So there's a table here with two categories, either the lower PEEP higher FiO2 ratio or the higher PEEP and lower FiO2. And this is will give a clear guidelines like about what to set the PEEP according to the FiO2. And this is driven from the ARDS network table about the protective lung ventilation. The initial settings for COVID-19 with ARDS. So the primary goal in ARDS ventilation is preventing secondary lung injury in order to protect the baby lung. The baby lung, which is the lungs not affected by the ARDS. So generally we start with a set tidal volume of 8 ml per kg of predicted body weight, and this is very important that we're talking about the predicted body weight, not the actual body weight. And then you have to observe the plateau pressure. The plateau pressure is very important in ARDS, and we are targeting generally less than 30, and the lower the better. And we will talk about how to manage the plateau pressure and how to achieve this target. So, and what is the meaning of the plateau pressure? So what if the plateau pressure is more than 30? What to do? So if the plateau pressure is high, you will decrease the tidal volume to 6 to 4 ml per kg. And again, this is your goal is the 6 ml per kg of tidal volume in severe ARDS. And the issues, what happens when you decrease the tidal volume? So as we know, let's go back to the minute ventilation. The minute ventilation is the tidal volume times the respiratory rate. So if you decrease the tidal volume, you may decrease the minute ventilation, and you will have buildup of the carbon dioxide. So how to overcome this issue? Again, you have non-ventilatory measures and ventilatory measures. And the ventilatory measure, what I will focus on, you can increase the respiratory rate to overcome this issue. Non-ventilatory measure, you will have a separate talk about the ARDS, and this can include sedative, paralytic agents, and etc. So what is the plateau pressure? So first, the peak inspiratory pressure is the highest level of pressure applied to the lung during inhalation. And it's comprised by two components, the airway resistance and the lung compliance. And this is again driven from the equation of motion. So the plateau pressure, which is what we interested in, reflects the lung compliance. So in order to achieve this, so this is the peak airway pressure, which is the highest pressure during inhalation, and you can see it reflects the trans airway resistance and the transthoracic pressure. The plateau, to get to the plateau pressure, we need to eliminate the trans airway resistance. And again, when we talked about the airway resistance, we know that a component of that is the flow. So if we stop the flow, make it zero, we'll eliminate the airway resistance component, and it will be only left to the lung compliance. And this is what happened here. Here we applied a maneuver called an inspiratory hold, where all the flow will be zero. So therefore, eliminating the trans airway resistance, and again getting the plateau pressure, which reflects the transthoracic pressure. So here we will have a simulation just very quickly. Okay, so here we have a screen showing the ventilator. This is a Draeger ventilator. We have it in our ICUs when we mostly use it. So you have, this is a volume control, volume assist control mode. And you have the parameter here below. These are the parameter that you will control, and you have here the measurements, and you can check different things. And here you have the waveforms First one is the airway pressure, the middle one is the flow, then you have the volume. So in a volume assist control, you control the FiO2, the tidal volume, you can control the respiratory time and the respiratory rate plus the beep and flow. So initially when you have a patient, you usually will start with an FiO2 of 100. Respiratory rate depends, you can set it at 12, 14, and you see the patient. So let's say that this patient with moderate ARDS, and we have a tidal volume, we set it at 500. Okay, so here you have the plateau pressure, and we can measure it on every breath because we have a hold in every breath, which is 26, and this is the peak airway pressure, which is 40, and here you have the minute ventilation. So if we say that this patient has severe ARDS, okay, and the lung compliance is very, very low, and you're setting a tidal volume of 500, so immediately you will see that the plateau pressure is 43, which is above our target, and we need to decrease it. So what did we say? We can decrease the tidal volume again by the protected body weight, and you can, let's say we decrease it to 350, and we will check and observe the plateau pressure and what will happen to it. So you can see that it dropped to 33. Again, I can decrease it further according to achieve our target according to the protected body weight. Okay, so to the 320, and we'll see what will happen to the plateau pressure. The plateau pressure decreased to 31.6, but we have another problem that I told you we will expect, which is the minute ventilation dropping. So to overcome this issue, you need to increase the respiratory rate and observe again. So we will observe what will happen to the minute ventilation, and you can see that it's going up. And let's see if that's enough, or do we need to increase the respiratory rate. But for now, it seems to be enough, and you will follow these things with the blood gas analysis to adjust accordingly. You see the plateau pressure is still high. Of course, I'm talking here about ventilatory management only. I'm not talking about any other measures that may decrease the plateau. That will be discussed in the ARDS presentation. So as you decrease the tidal volume, you will decrease the plateau pressure. I'm not going to go in and talk about the driving pressure. I'm now focusing only on the plateau pressure. So this is a volume assist control mode. Okay, and if we say we'll switch the mode now. So this is a pressure control assist mode, and you can see the waves again at the top, the airway pressure, the flow, the volume, and in this graph, this mode, you set the inspiratory pressure, the FiO2, the respiratory rate, the beep, and the inspiratory time, and you have the measurement here. Very importantly, like if you set the, for example, let's say usually we start with low, and let's say that the inspiratory pressure you're applying is 17. It's very important to be mindful of the tidal volume, because in this mode the machine will give a pressure regardless of the volume. So you need to pay attention to the volume, because the volume will be dictated by the patient, by the lung compliance of the patient. So if the lung compliance is improving, is okay or near normal, you will see the tidal volume. Like here with inspiratory pressure 17, we were getting tidal volume of 70, and with improved lung compliance, we're seeing now that the tidal volume is improving, and as you improve the compliance, the tidal volume will increase, and this is very important to keep an eye on. So you see the tidal volume is going up because the compliance is improving, and with it the minute ventilation is improving. And again, you can increase the respiratory rate. The beep will play a part here in the oxygenation as well. Now, again, back to the volume control, volume assist control mode. There's another additional setting in this ventilator. It's called the auto flow, which is basically a pressure regulated volume guarantee mode. And this is a mode that combines to some extent the pressure control and the volume control. So here you set the target volume, and the other parameters are the same, but you have a limit on the pressure. Like the limit in the pressure now is 40. So you see the pressure here is 18, but let's say that this patient has severe ARDS. And we'll see what will happen with the tidal volume that we set. So the tidal volume was set is 300, but we can see that the the tidal volume is not reaching our target. It's not achieving the target because the airway pressure is reaching the limit that we set. So this mode combines both of them, but the same principle will apply to all. The same thing, you can decrease the tidal volume, increase the respiratory rate to overcome whatever problem. Like for example here, we have a low minute ventilation. We can increase the respiratory rate, and that will improve to some extent the minute ventilation, as we can see now. But you need to keep an eye on the pressure as well. So that's it. Thank you very much, and wish you all best of luck.